Today's conversation is a must listen if you are a woman over 40 who has ever been told your bones are fragile, your future is downhill, or that osteoporosis is just another part of aging. What if this story is incomplete? Well, today I am joined by Dr. John Neustadt, a naturopathic doctor, researcher, and #1 Amazon best-selling author in the field of osteoporosis. He is the founder and president of Nutritional Biochemistry, Inc., has published more than 100 medical articles, and written 4 health and wellness books, and helped train physicians across the U.S. in integrative and functional medicine. His latest book, Fracture Proof Your Bones, challenges the fear-based medication-only approach to bone health and replaces it with something far more empowering: education, choice, agency. In this episode, we are talking about why bone density scores don't tell the whole story and what really drives fractures, how midlife and menopause change the game, and what women can start doing now to build stronger bones without panic, shame, or being talked down to. If you want facts, clarity, and a whole lot less fear around your body, you are in the right place. So let's bring John on and hear what he has to say. Hello, badass listeners. Thank you for joining me today. And today I have a very, very, very interesting guest. And I know that what he has to say is going to resonate with you, because as midlife women, we are all starting to encounter osteoporosis and or diagnosis of that or other things that come into our lovely midlife sphere of things that we have to deal with. So today, my guest is Dr. John Neustadt, and he is a specialist in how to not fracture your bones once you get to a certain age. And he's done extensive research, written books, and I am going to turn the mic over to him so that he can introduce himself, talk to you a little bit about that, and then I have a little story to share with Dr. John. So...
Well, thank you for inviting me on to your podcast. I'm excited to share about this because I am so passionate about educating people, and primarily affects women. So, educating women about their options, about what is possible, because so often they get the message when they get this diagnosis that that's it, that's the end of the road, and there's nothing you can do about it. And that's not what the research shows. And in fact, the research shows that this condition is woefully mistreated and undertreated, precisely because doctors are not trained in the integrative research of what the research shows can be accomplished when you look more holistically through clinical trials, epidemiological research, all very well documented. And I love shining a light on that and educating people about what they can do.
I think you're absolutely spot on. And I think it's scary as a middle-aged woman myself. So a couple of years ago, this is my story. I'll launch into my story now. I decided I wanted to learn to play polo. It's a pretty aggressive sport, and I don't consider myself to be in bad shape. But, things happen when horses are involved, especially if you're wielding a polo mallet and, running down the field at a certain speed. I personally got a little aggressive, and rather than passing the ball and going back around, I decided to slow down, stop, and reach behind me. When I did, I pulled the horse up off the ground in the front, and off I went, polo mallet attached to my right hand, and shattered my right wrist. So, having said all of that, of course, my physician was like, okay, well, you broke a bone. I'm like, yeah, but I fell off a horse playing polo. So, it's not like I banged into the wall or did something silly. This was a pretty severe impact. So, of course, my physician said, we need to get you a DEXA scan. And it didn't reveal anything horrible, some just normal stuff for my age. But still, I think, that's what happens. We break a bone or we feel whatever, and then, off we go to get scanned. And I think what I've heard you say and what I've, learned in your book and so forth, that's not the be all and end all. And just because you have a bone, scan does not mean that it's the end of the world. So can you speak to that a little bit?
Yeah, your experience is spot on. It's the norm. And when I say that is most women are not getting screened routinely with a bone density test. In fact, in Medicare age population, which is 65 and older, by definition, the highest risk for osteoporosis, and about 95% of those patients who are eligible for screening are not getting screened.
Hmm.
And in fact, oftentimes the first sign that somebody may have a problem is that they break a bone. And so your physician was correct at your age to order a bone density test. The Bone Health and Osteoporosis Foundation, of which I'm on the corporate advisory roundtable for that association, their recommendations, which I agree with, is anybody, man or woman, 50 years old or older, who breaks a bone should get a bone density test because it is a silent condition. People could be losing bone density, their bones could be getting weaker for years or decades without knowing it. It's typically asymptomatic. So that is correct. And I'm glad that when you got your bone density test results, it didn't show that you had bone loss. And of course, if you fall off a horse, that's not your run of the mill. Every day I tripped on a throw rug in my house and landed and broke my hip, which actually happened to my mother-in-law 20 years ago, which is what got me involved in this issue. I was in clinical practice, seeing patients and working with them with some bone issues. Some of them had osteoporosis, and I was working from an integrated perspective, just like I look at the research and do now. And their bone density was going up, diet, lifestyle, exercise. And so I was happy. With my mother-in-law, I was giving her some advice, some recommendations for those similar areas, diet, lifestyle, supplements. And she was also on Fosamax that her physician recommended, and her bone density was going up. So her physician was happy, she was happy, I was happy. But then she tripped on a throw rug in her house and broke her hip. And I
Hmm.
thought to myself, something is wrong with this picture. And I started to look at the research in more detail. And what I found absolutely shocked me that since the 1990s in the research, it's been documented that a bone density test predicts less than half of women who will break a bone. And study subsequent to that, after that in 2008, came out that determined that for women with osteoporosis, a bone density test only predicts 44% of those women who will fracture and only 21% of men. And in fact, the major risk for osteoporosis fractures are factors largely other than bone density. And yet, despite that research and that understanding, the vast majority of discussions in a doctor's office are focused almost exclusively on that narrow window, on that number on the test, improving that number on the test, instead of looking at the patient and having a conversation about what can be done to reduce fractures as much as possible.
That's really interesting. And I'm glad you brought up the point about the numbers, right? And I think that also happens with like blood pressure, right? Where you're showing high blood pressure, whatever. Okay, so you get a prescription, and then that brings the number down, but doesn't necessarily, I don't think, treat the whole. I'm not a doctor, clearly, but the holistic approach, right? And I think what I'm understanding is that, like you're saying, it's not just the number. There's more to it. So I'm very curious about what the more is.
Well, I think that in very simple ways for people to understand it when they're talking to their doctor or they're reading things online, there's an important distinction between testing that is done in a laboratory or in a radiology department and what we consider clinical outcomes. So, for example, you use blood pressure as an example. Your blood pressure number is a number that is generated from a blood pressure test. It's a number on the test. Well, when talking about the blood pressure medications and lowering blood pressure, the next important question to ask is, well, has it been shown that by reducing the blood pressure by using a medication, that it also prevented strokes and heart attacks? And the answer is yes. Blood pressure medications can do that. So with a bone density test result, the question is, it's a number on a test. If we change that number on the test, does that mean we're also reducing fractures? And what the research shows with the osteoporosis medications is that it really doesn't, they don't do as good a job as most people are led to believe. And I think as most clinicians believe. There is a place, don't get me wrong, for the medications, and they do play a role in terms of having those important conversations and making a decision of whether one is appropriate. But if somebody has never had an osteoporosis fracture, meaning they're diagnosed with osteoporosis, but they have not broken a bone yet, clinically, what is trying to be accomplished is what's called primary fracture prevention. That is preventing somebody from getting their first fracture. And what we know from the research is that the osteoporosis medications don't do a great job at reducing both vertebral and hip fractures. And in fact, the only medication that has been shown to do that in primary fracture prevention for both areas is intravenous Zometa. And so the Fosamax medication that my mother-in-law was on, having never broken a bone before with osteoporosis, wasn't even effective at reducing her hip fracture risk. She was still exposed. And yet that understanding of the research is not widely understood in the clinical community, to have those very sophisticated, more nuanced conversations about the medications. And this isn't just opinion. There was a study that came out that concluded the same thing. And so when looking at the data in writing my book, what I think is important in my medications chapter, aside from understanding the medications and how well they do or do not reduce fracture risk, is giving patients questions to ask their doctors, because it becomes very complicated very quickly. So very clear, concise questions to ask to understand if the recommendations are appropriate. Like, has the medication been shown in somebody with my diagnosis and my medical history to reduce fractures? And so that means somebody who has never had a hip fracture or a fracture with osteoporosis before, has the medication been shown to do that? And similarly with my medical history, what we see is there are a lot of different conditions that create osteoporosis and other medications that create osteoporosis. And so has the FDA approved osteoporosis medication that I'm being recommended, has it been shown in that patient population? Meaning somebody with, let's say I have irritable bowel disease, because irritable bowel disease causes osteoporosis. Or let's say I'm on a proton pump inhibitor, which causes osteoporosis and increases fracture risk, or an antidepressant like a Prozac or Wellbutrin. Have those been shown to, in people who are taking those, have the medications been shown to reduce fractures? And there's a real cautionary tale out there in the research of why this is so important to understand those questions to ask, because the osteoporosis medications, the vast majority of the research are in postmenopausal women with osteoporosis. Now, the underlying mechanism, or the reason why women in that stage of life lose bone, is because of the drop in estrogen. The reason why somebody taking a proton pump inhibitor or another medication loses bone is totally different. So it's not, it is intellectually a big leap to say, okay, the drug worked in one patient population, we're going to just apply this to somebody across the board, which is what the medical community by and large does, because they've got somebody in their office with bone loss. And maybe it's because it's a proton pump inhibitor. And they said, well, it works for this other population. Let's give it to this patient as well. Well, somebody decided, and that's common practice, called off-label prescribing. It's commonly done and an acceptable practice. But in this case, it's a cautionary tale, because when they finally decided to research the effect of combining an oral bisphosphonate like Fosamax with a proton pump inhibitor, what they found is that taking the two together actually increased the person's risk of fracture compared to just taking the medication by itself.
Wow. That's a big deal.
It is a big deal.
So the thing is, like you said, it's not one size fits all. There's so many other factors that could be causing the bone loss. Obviously, age, postmenopausal, all of that stuff. And like I said, when I got my scan back, it was normal for my age, and I just turned 67. So it's all of those things. And I was like, okay, but I don't, but like you said, it's a silent thing that can sneak up on you. So what can um someone, a woman of a certain age, now obviously it sounds like it's definitely affects women more because of the loss of estrogen than men. So what can women do to ask those kinds of questions? Because it's really difficult because someone, like you said, might not know to ask a question like, well, what is it related to something else that I'm on? Or is it,
Correct. That's a great question. And I think that like any, sort of complicated medical issue that somebody may be dealing with, it's about coming into the appointment with your questions written down. It's
Hmm.
very difficult to be, listening to a doctor talk about things. And not all doctors communicate the same, how do I say this, as well as others. Meaning, some have a hard time talking in language that is easily understandable for a layperson, and it can get technical. And even if it's not technical, it's also an emotional situation. And we know when the stress response kicks in fight or flight in stressful situations, people just have a harder time internalizing information and making decisions. So being organized and prepared and going in with your questions written down is very important. If you have somebody that could go with you also to ask this question, that's excellent too, and could take other notes or remember things that you might not remember. It's really great strategy as well. But that's why, in my book, I have these take action sections and then write down the questions I think are some of the most important questions to ask. So they're right there.
Yeah, I love that you have that available in your book as well. And the other thing I was just thinking of is, as we were talking, is that, sometimes you have the questions written down. And I know that when you start getting the data, and a lot of times, like you said, physicians tend to speak in, they know what they're talking about, and they just assume that you're going to know what they're talking about as well. And then you go back to, your spouse, your partner, your family member, and be like, and they're like, well, what happened at the doctor's office if they couldn't be there? And you're like, well, it was this, I don't know. He said a lot of things I didn't understand. And I think that happens a lot too. Love the idea that you're talking about is, be prepared and, have. Here's the other thing too. I think that, we are in a situation of information overload, and we're getting information from all over the place. And you go on Chat GPT and you're like, ask all these questions. And, it's not always reliable responses that you get back. So for you to have your book, and by the way, the title of your book is Fracture Proof Your Bones. It acts as a guide to help get those questions answered, how to formulate those questions, and then take them to your physician.
Yeah, and also to educate people so they could just make better decisions and understand what the current research is showing.
How do you work with your patients? So when someone would come to you, how would they come to you? Would you be their primary care physician? Would they be referred to you?
Yeah, so I'm not in clinical practice anymore. I've had to
Okay.
give that up because as my work has become more well known, and I'm traveling, trying to educate people and speaking at medical conferences and developing solutions, I've just become too busy to do both. Now that said, one of the things that I do, whether it's talking to somebody who just I'm having a conversation with, or one of my patients when I was in clinical practice, is the first thing I do is have them take a deep breath, because almost universally, by the time they get to me, they've had the diagnosis and they're scared because they're fearful of they having a mother or an aunt or somebody they know who broke a hip, and that was the beginning of the end.
Yes.
If you're a woman and fracture a hip with osteoporosis, there's up to a 36% chance that you're going to be dead. And in fact, a woman's risk of osteoporosis fracture is equal to her combined risk of breast, uterine, very 30 seconds somewhere around the world of breaking a bone due to low bone health or bone quality. And so what I do, and oftentimes also, if they've had an appointment with a doctor, they've been given this diagnosis and they've left scared. I've had patients tell me the doctor told me that if I don't take a medication right now, starting right now, they won't work with her. They would fire her.
Yeah.
Or that's used in the industry, got fired a patient. Or, and actually, frankly, it should be the reverse. I mean, this is a service industry. And if you don't like the service you're getting from your doctor, you are totally free to fire your doctor and go find somebody who's going to talk to you the way that you want to be talked to and help you understand and make better decisions. But I've had patients come to me and say, my doctor told me that if I don't start taking the medication right away, I'm going to fracture. And with no ambiguity, like this is a certainty. And that's just not what the research shows, not even close. So the first thing I do is have them take a breath and I help them calm down so we can actually have a productive conversation. And I start talking to them about the limitations of the bone density test, what I already told you, how they're not as predictive for fractures as most people think, and how fracture risk depends on factors largely other than bone density. And I tell them that, yes, this is serious, but it's not an emergency. There is time to educate yourself, to learn more, and create a holistic bone health program that makes sense for you.
And I love the holistic approach that you're referring to. How would someone find someone like you that understands that more holistic approach? Through a more holistic approach, can that be reversed to a certain degree?
For your first question, the answer is there really isn't anyone out there that I'm aware of that understands this approach like what is in my book to the level of detail and implementing these plans with patients. And so oftentimes what happens is patients will read my book and they will take it to their doctor's appointment. They'll ask questions that are in the book, and oftentimes the doctor will say, okay, let's give this a try. And they're willing to, if the patient is concerned about taking the medication or just wants to try another option for 12 or 24 months. And oftentimes the doctor's like, okay, let's give this a try, because the doctor knows that it's not just somebody going off, that they actually are, there's a plan. And it's something that the doctor is still involved with, because they're going to retest and they can still be involved with the care. And oftentimes they're okay with that. And then the second thing is there are clinicians out there who have told me that they prescribe my book and they say, read this book. This is what we're going to do. And then starts implementing that with the patients. And so those are a couple strategies where people can really be certain that they are getting the care that they want, because most of the vast majority of the recommendations in my book, people don't need a doctor to do at all.
Mm-hmm.
Most of them have nothing to do with medications. The difference is, or the where clinicians really become vital and important, is retesting to track changes, which is important. The bone density test is limited in its usefulness, but it is an important test, and it should be, in my opinion, done and tracked. But there are also other tests that, people should be running just to make sure that, some blood tests are important to run, and annual blood tests are important. And then a medication review is often a missing piece that is really important as well. There's a long list of medications. I mentioned a couple of them, the proton pump inhibitors and the acid blockers. The acid blockers, which are proton pump inhibitors, and the antidepressants, specifically those that elevate serotonin, to get the medications reviewed. And a lot of times doctors won't know that they're prescribing medications that damage bone. It's no fault of theirs. Those are listed in my book, and having a medication review is important to have with a clinician or with their local pharmacist. In terms, but everything else, diet. You don't need a physician to help you, change your diet. There's strategies in the book and walking people through exactly what to focus on and how to transition into eating the way that is in line with what the research shows is associated with a 20% reduction in osteoporosis and a 20% reduction in hip fracture. You don't need a physician to help you understand what you could do to start exercising and what your options are. You don't need a physician to help you start working on improving your sleep. All of these are important. I'll just mention the sleep component because it's often overlooked. Like many things, I feel like I'm saying that over and over. United Kingdom, a study was done that showed that 17% of all incident fractures, I mean fractures that are occurring, are due to sleep problems, due to not enough sleep. And the research is clear is that people not getting enough sleep, if you're getting less than an average of 6 hours of sleep a night, which happens frequently in the elderly, that it's associated with a much faster rate of bone loss. And I'd also say the biggest risk with fractures is falling. 95% of fractures occur because somebody falls. 5% of the elderly are prescribed a medication that increases the risk of falling. Right. And so that's another piece, not just damaging medications that damage bone, is that are you on a medication like Belsomra, one of these medications is often used for sleep or anxiety, also increase fall risk. If you're on a blood pressure medication and you're over medicating, your blood pressure drops too low, that also increases fall risk. So these things are all intertwined. Well, for many of the suggestions and many of the things that people can do, a doctor is simply just not necessary. Question about can you reverse it at any age? I've never seen any data that you can't. And worked with patients all the way up into their 90s, and these are anecdotes, but the saying goes, one case is an anecdote, two cases are data. So, I've had multiple patients in their, 70s, 80s, and 90s tell me, going through, working with me or using the recommendations that I'm providing in my book and through my research, that they fell and they would have fully expected to break a bone because they did before and they didn't again. Or one lady in her 90s who was so frail that she would stub her toe on the end table and break her toe. And that stopped happening. I believe it can be reversed. And in terms of one of their biggest risks and I think an example of how things can be reversed, it's not necessarily a one-way street of decline. There's a study all the way up. The eldest participant was 85 years old, I believe. And it was looking at can people, even elderly, still increase their muscle mass, because lots of muscle as we get older is a big risk factor for falls and fractures and is associated also with osteoporosis. And what they found is that when people ate enough protein, and that's another component of my dietary recommendations, is you have to be getting enough protein. There are 180 to 200 proteins in bone alone. And the amount of protein somebody eats can account for 2 to 3% bone mineral density, just that. What they did in this clinical trial, they were looking at strength and muscle mass, that even all the way up to 85 years old, when they got enough protein, which by the way is more than what is recommended by the US RDA, the US government recommendations, and did resistance exercises, that their muscle mass increased. In contrast, people who just ate in a different study, just consumed the US RDA amount of protein that's recommended, their muscle size and muscle circumference of their thigh actually decreased in over just a few weeks.
Yeah, the muscle mass is very interesting because I've noticed that, so I broke my wrist in, 2023. And then I recently had a car accident last year. No broken bones, thankfully. But I do notice that through those injuries, my decrease in, actual like weights, resistance exercise, and those types of things, my muscle mass has decreased. And like I said, I consider myself in fairly good shape, but I've started doing some weight training and some strength training because I feel like, okay, now that my body has healed, I want to make sure that, injuries become less. So I completely agree with you, but I mean, it's like, you start, a little flabby under the arms and, squishy muscles and all of that stuff. And I think, I don't know, this is just kind of my interpretation, but if somebody gets a diagnosis that they have osteoporosis or whatever, I feel like then they're in their mind, they're like, I'm fragile. I need to stop doing things. I need to just sit quietly in the living room and not do anything. When in reality, the opposite is true. Start building, start doing things to, like you said, diet, exercise, start building those, carefully, but don't just retreat.
Yeah. Well, I think for most people, if they view this in what I believe is a healthy way to view a diagnosis like this, is that it's the body signaling to you that it has not been given the environment that it needs to thrive. We adapt to our environments. I mean, I think everybody understands this in terms of, the people they hang around with, and the saying that we are the sum of the 5 closest people we associate with. And, environment has a big impact on personality and mood, but it also includes our internal environment, and part of that is the food, the biochemistry, the nutrients required for our body to heal and thrive and help us live long, healthy lives. And when a diagnosis happens, I hope that one of the lessons that somebody can take from it is, this is a signal for me that I've not, something's missing. And what can I do to improve that? Because there is always things that people can do. And you don't have to go to a gym and start pumping iron right away. And there are many things that people can do to reduce their fracture risk. Just going for a walk, walking 7,000 to 7,500 steps a day is associated with a 50 to 70% reduction in all-cause mortality. That means death from anything. If you like gardening, garden. If you like taking, some exercise classes, as long as they're safe, I do think that if you have the diagnosis of osteoporosis, modifying certain moves, especially like in yoga, is important, and working with a trainer or somebody who understands that body and what it needs now to make those modifications so it's safe is really important and crucial, in fact. But also there are great books for that too. You're not alone. There are people who have done the work, who have provided resources. There are wonderful books out there on exercise and osteoporosis, and there are trainers out there who understand this as well.
Yeah, I love that. And so you're saying it doesn't have to be a death sentence, right? So the other thing I wanted to mention is that this book is not just a book, and this is my own, once again, personal opinion, a book that you pick up after you have been diagnosed. This is something I would say to pick up your book now, wherever you are in your early midlife journey, and start incorporating some of these things into your daily routine, or all of them, so that you can, as a preventative, push it down the line, right? Don't wait till you break a hip, or don't wait till you're have a diagnosis of, really bad osteoporosis. But get a jump on things, literally and figuratively.
I appreciate that you said that, and hopefully it's not just pushing it down the line, but it's avoiding it all together. I mean, what we know is that peak bone density occurs in our 20s, so basically 20 to 29, maybe a little later for some folks. But the activities that we do when we're young and through our 20s and 30s really have a profound effect on our bones decades later. In fact, sometimes I've run across osteoporosis being referred to as a pediatric condition with geriatric consequences. About every 10 years, I mean, bone is a living tissue. Every 10 years, our bone is completely new. The cells in our bone, there are some cells called osteoclasts that break down old worn out bone, and osteoblasts that create new healthy bone. And so every 10 years, it's like you have brand new bones. And so this is a condition that is decades in the making. And this is not, unique to just bone. I mean, other tissues in our body, like our intestines, do the same thing. And the intestines turn over at a faster rate than bone, but they do the same thing. But with respect to bone and getting a jump on it, there are many things that people can start doing younger in their lives There are a lot of women who are prescribed medications in their 20s and 30s that are putting them at risk. There are lifestyle habits and dietary habits that are putting people at risk. And the nice thing is when you follow this holistic approach and read the research in the book, and I mentioned this over and over, where it corresponds to overall health as well. Bones are connected to everything else in our body. When you're giving that healthy diet, a healthy lifestyle, healthy nutrients that the bones need to thrive, the research is very clear that it also reduces the risk of other diseases like heart disease and cancer and death from cancer and diabetes and obesity and Alzheimer's disease. And the list just goes on, because that healthy dietary habit, that healthy lifestyle pattern is healthy for everyone.
Yeah, it's funny because it's not funny. But I think people wait until something happens. Like you're like, oh, I want it, and they don't think about the holistic lifestyle thing. Like it's a lot of times it's centered around I want to lose 20 pounds or I want to do whatever, rather than the big picture. Like you just said, there's so many other factors that will improve in your life if you start to adopt some of these, more holistic approaches to, there's food especially, all of the preservatives and all of the processing and everything, that stuff all does not help us at all. It may be quick, it may be easy, it's going to be, whatever, but it doesn't help us from a holistic standpoint. If you're eating cleaner foods, then you're going to be better off in the long run.
I love that you mentioned that, because there's a category of, they're called foods, but I think they're really environmental toxins, called ultra processed foods. And 60% of calories in the American diet now are from ultra processed foods. And those are the packaged foods that sit on shelves, that have a long shelf life, that are, convenient for people to just grab, which I understand. But that dietary pattern is now associated with osteoporosis, Alzheimer's disease, cardiovascular disease, diabetes. The list goes on and on. The body, those artificial chemicals, and there are 10,000 chemicals that food manufacturers can put into our food, and most of them have not been studied for their health effects. And so I think the cleaner somebody can eat, the more that somebody can eat foods where they look at it and they can say, oh yes, that's a beet, or that came from this plant, or that was a chicken, the healthier that it's going to be. And it's really not that complicated in terms of understanding, is something an ultra processed food? Should I eat it or not? I've settled on the practical solution that if you read a package of ingredients on a food and it's not something that you would, have commonly in your kitchen, it's probably an ultra processed food. Or if you read a package of ingredients and you don't know what one of those ingredients are, it's probably ultra processed and not good for you. And I'm a realist. I don't think that, it's realistic to completely avoid these, but the research show there's appears to be what's called a dose response effect. And what that is the more exposure somebody has to these foods, the worse the outcomes and the worse the risks. And the threshold, the cutoff in many of the studies appears to be about 10%. So if you have 10%, over 10% of your calories from ultra processed food, that's a real red line in terms of risk. And I think, people should aim for lower. But think about it for a second. Right now in America, the average American, 60% of their calories are from ultra processed foods. It's a huge health challenge that we've got.
Yeah. And it's not easy, like you said, to make those choices. Things are moving very fast. To eat healthy is, in some people's minds, a luxury, to buy fresh foods and vegetables and all of that. And it is much easier and more economical in the short term to buy processed foods. But I agree, if you are trying to read the label and you can't pronounce that word, or you don't even know what it means, that would be something to put back on the shelf.
So it's interesting. I made that exact comment to a clinician who was interviewing me for a podcast, one of her podcasts. And she really took issue with that. And I was so grateful because she really changed my opinion on that, it's too expensive mentality for some people and it's hard for some people. And she said, look, beans and rice are not expensive. And,
That's true.
you can get a can of green beans for cheap. You can get, some produce that's, really not expensive. There are ways to do it that are definitely economical. And that, part of the challenge, I think, is that it takes planning and it takes understanding. It is such eating the Mediterranean dietary pattern, which is what I do recommend and I talk about in my book. And that pattern is associated with the reduction in hip fractures, reduction in osteoporosis that I mentioned, but also the reduction in many other disease risks. That pattern of eating is predominantly a plant-forward diet, and it's the opposite of the standard American diet. And so one of the biggest challenges is changing eating habits, because most people are eating and grabbing their foods and cooking unconsciously. It just becomes a habit, which is that's how we work. That's how it is. So it's part of it is developing new habits. And in my book, I walk people through a process of transitioning into this healthier way of eating over 4 weeks or 6 weeks, whatever makes sense for them, but not doing it overnight, because for most people, it's a huge change. And radical changes done quickly tend not to be sustainable. And this is a dietary pattern and a way of eating that is not a fad diet. It is how somebody can eat to promote their health for the rest of their life. I was at a conference this last weekend and I heard a brilliant clinician, her name is Dr. Lodog, in her talk make a statement that I love. And it was, food can be the slowest form of medicine, or the fastest form of poison.
Oh, I like that.
It's the slowest form of poison, meaning you're actually poisoning your body and it's not showing up the results for years to come. What you're eating now is setting the stage for your health 5-10 years down the road. If I interview someone and they tell me their eating pattern and I can do an intake and understand what they're eating, I can predict pretty well the risk of what health problems they're going to have a couple decades down the road. Now, so what I recommend is people transition into eating this way over 4 or 6 weeks, whatever is comfortable, because it often requires shopping differently, getting different snacks, learning to cook differently, maybe with different spices. If they have a partner or a family, it does affect them. So working into that over time, it gives the best opportunity for creating sustainable new habits that are going to help people for decades down the road.
And I like how you said that it's a slower transition, or it's done incrementally, because it's just like anything, like you said, if you try and jump in and make a huge change, you're not going to be able to sustain it, because it just is overwhelming. I don't care what it is, if it's food, if it's, a job, if it's whatever it is, it's not going to be sustainable, because you don't have those little micro habits. Like you said, just going to the store, maybe it's starting to read labels and getting one thing instead of the other thing, and each week. And I also like what you said about the clinician taking you to task and saying, rice and beans are not that expensive. So I think that, like you said, it's also a mind shift change that, okay, maybe I can't afford to go to the farmer's market and buy all these fresh ingredients or shop at Whole Foods or do whatever, but I can purchase these things that are a smarter choice for me and for my family. And I think also when you have a family, you got to kind of makes it a little bit easier if you can get the support of the people around you. This has been a fascinating conversation, and I'm sure we could keep it up. But what I'm going to tell people is, I don't care how old you are, go get the book right now. Go get the Fracture Proof Your Bones book. You can get it on Amazon. I'm going to put a link in the show notes. How can people get in touch with you and learn more?
So the best way is through my website, which is nbihealth.com. NBI stands for Nutritional Biochemistry Incorporated, because I love biochemistry. I'm kind of a little bit of a nerd in that way. So nbihealth.com. com, and that's the best place to find my articles. There's a lot of free content on there, products I've developed to help people. I actually developed for my patients because I could not find doses of nutrients shown in clinical trials to work and in existing products that I needed for my patients. So that's why I started to create some of these solutions to help them. And so all that information and research is on there, and people can also get in touch with me through the website if they want.
I love it. All right. Go get the book. Go to his website. Seriously, don't wait till you break a hip. Thank you so much for joining me today, Dr. Neustadt. And for those of you who are listening and you are like lit up right now, I advise you to also share this episode with someone else that would find this information helpful, and start today being more active, looking at your holistic lifestyle, so that you can avoid, being that person. So there's still room for change. All right. Thank you so much for joining me today. And like I said, feel free to share this episode with a friend, rate it, review, follow Dr. John, and I will see you next week on Midlife Strategies for Badass Women. Dr. Neustadt, thank you so much for being with us today. Appreciate you.
My pleasure. Thank you.
Hi, my name is Adam Shibley. I'm the host of Podcasting Business School, and I am the creator of the Podcast Growth Coach Certification Program. And today I'm here to brag on my newest certified podcast growth coach, Sue Willoughby. Sue has really excelled as she's gone through the certification process, which was not easy, by the way. She completed all the homework. She did all the testing. She even did a one-on-one final exam with me. And I was just continuously impressed from week to week, the improvement that she made. And I'm really impressed at the creativity that she displayed, but also her ability to effectively communicate and coach people. So if you're somebody who feels like your podcast could use a little bit of a pick-me-up, if you feel a little bit stuck with your download growth or maybe in need of a rebrand, I highly, highly, highly recommend talking to Sue and talking about getting her help with your podcast growth.
Hey, it's me, Sue Willoughby, your certified podcast growth coach. If you are pod curious, I encourage you to book your podcast success call today. The link is in the show notes.